Good evening, everybody, and best wishes to one and all for a very happy and healthy 2020. My name is Larry Fleming. I'm president of the Tullamore Lions Club, and I'm also your host for the rest of the evening, which will take approximately 50 minutes to an hour. So hopefully you'll be out shortly after 9 o'clock. Tonight we are very, very honoured to be involved in the launch of Hooves for Hospice. It's the first major fundraising drive for the proposed new Midland Regional Hospital. It's a level 3 hospice, we hope, and it's badly, badly needed, as we are the only area in the entire country that does not have a level 3 hospice. And we're also extremely proud to be involved in this project in association with our colleagues throughout the Midland region in all of the other Lions clubs in Laois, Westmeath and Offaly, where we have promises of support from Abbey Leaks Lions Club, Port Laois Lions Club, Port Tarleton Lions Club, Burr, Edenderry and Mullingar, and I notice a lot of representatives from these Lions Clubs are here tonight. We're very, very happy. It's a joint project, and it's probably the first time it's probably the first time a project of this sort has ever been attempted, but it's in aid of a very, very, very good cause. As some people may or may not be aware, as Lions members we serve our communities, and this may involve offering financial support to families, organisations, or even individuals who might have fallen on hard times. We also, at various times, may offer support to national projects, and in times past we have even offered help to international disasters such as flood relief or famine relief or earthquake relief, or as is happening at the moment, fire relief in Australia, which obviously will require support from organisations such as ours around the world. However, it's the local region we're talking about tonight, and as I said a few minutes earlier, the Midlands region is the only area in the entire country that does not have the facility of a level 3 hospice. A level 3 hospice is a specialised facility that provides patients with excellent end-of-life care that is generally pain-free, and all of this is provided by fully qualified, specialistly trained palliative care staff. Our first speaker this evening is far more qualified than me to extol the virtues of a level 3 hospice. Sharon Foley is the CEO of the Irish Hospice Foundation. Sharon has kindly travelled down from Dublin tonight to be with us. She has been all her life a passionate advocate of the enhancement of end-of-life care for patients whose illnesses are no longer curable. And she is also passionate about reducing the impact of bereavement on families, particularly children. So without further ado, who better to introduce the night to you than the CEO of the Irish Hospice Foundation, ladies and gentlemen, Sharon Foley.
Thank you so much. I'm really, really excited, and I'm really, really honoured to be asked to be here tonight, because what Larry didn't mention is I'm also a Laois woman, and I'm also a former member of the Lions Club in Port Laois as well. And I'm really excited because I have been passionate about this Midlands project since I took up the post in the Hospice Foundation many, many years ago. And I used to work in the Midland Health Board many years ago with Dennis, and I see loads of my colleagues there. So there's a real sense of buzz and excitement here tonight. And what we're going to talk about, I'm going to bring you some of the facts as to why we're here tonight and why it makes the difference. And I have the advantage of maybe having that kind of balcony view nationally, being able to see where the developments are happening everywhere else. But we're here tonight because there's 300,000 people in the Midlands who I believe are being denied the same care at end of life as people in other regions, and that's a fairly stark statement. We have one of the lowest, and I talk we, because I still consider myself a Midlands girl, one of the lowest levels of state investment nationally. We're the only region without a solid commitment for a level 3 hospice unit. So keep that in your mind, the only region without a commitment. And there have been tremendous improvements in home care in the Midlands. Absolutely fantastic credit to the palliative care teams who were all around the room here tonight. Amazing achievements. But we see that, and when you look at cancer patients, and unfortunately some patients with cancer do die, 36% of cancer patients in the Midlands die in an acute hospital compared to 25% in the Midwest. And I think we deserve better. So these are the services that are available, and there is lots available. It's not that there's no palliative care in the community. We have a specialist palliative care home care teams, and they're providing over and above performance of any other home care team in the country. Very high percentage of patients being able to die at home in the Midlands, and that's a fantastic achievement. We've 2 consultants in palliative medicine. Michael is here tonight. I'm not sure if Pauline's here, but they've been very much involved as part of the, hi Pauline, and part of the journey and the discussion. We have a number of level 2 hospice beds, a great unit in Athlone, some beds in Portlaoise, Mount Mellick, and then they are all with potential to support a regional level 3 unit. We have some staff providing specialist palliative care in the acute hospitals, but there are still shortages there. We have a hospice-friendly hospitals programme in Offaly and Mullingar, actually in Portlaoise as well, and they have got funding for a coordinator for end of life, which is awaiting enactment. I'll be talking to you, Pat, later on about that. There is funds there to do that, and that's about recognising that people die in the acute hospital. But there's still no inpatient unit for specialist palliative care. And I would say there's been talk, but there's been no action. The National Policy for Specialist Palliative Care was defined in 2001. We're nearly 20 years on. So 20 years on, seriously? In 2001 it said that each health board area, this was the health boards, we've gone through a couple of iterations since then, should have a comprehensive specialist palliative care service. There's been at least 3 strategic plans in this region to develop that regional inpatient unit. We funded some research in 2013 which really documented what was needed, and the whole team came together under Dr. Phil Jennings to decide what was needed, what was the plan, and all of that was decided. Nearly 20 years on and still no action. So I'm going to bring you back to basics. What is a level 3 unit? People talk about health service and the jargon and all of that. Is it a hospice, a level 3? What is a level 3 unit? It's often called a regional hospice. And we call it regional hospice because that's what the public, that's what Joe Public resonates, that's what they understand. And what it does is provides a whole multidisciplinary level of specialist care, particularly for patients with very complex conditions at end of life. But even more importantly, it provides a central hub for all of the other services that happen in the community, be they the home care, be the acute hospital, nursing homes, so that no matter where you are or what your illness, you can get the best care possible at end of life in the palliative phase. And in particular, families are supported during illness and after death with both space, support, comfort, bereavement care. That's what a level 3 unit is. So it isn't that everybody suddenly moves from here to die in a level 3 unit. It acts as a central hub and it supports all the other services that are around in the county. And I've seen all of these units developed in the last 10 years all over the country. So the facts. So the patients and the families are being denied the full range of services that come with the level 3 hospice. A few years ago I looked at the investment across the country. I think it was around about 2016, and the investment in Laois, Offaly, Longford to Westmeath was a fraction of what it was in other counties. So at that time it was €7 per person compared to over €30 in the Midwest. I don't think that's fair. I don't think that's equitable. 36% of cancer patients die in the acute hospital, which means that when the home care teams can't deal with what they have, or it's very complex, patients have no choice. Families have no choice. They have to go into an acute hospital. And when you look nationally and ask people where they want to die, the acute hospital, good enough as they are and great service they are, it is the last place people want to die. So why is the Midlands being disadvantaged against all the other areas without access to a hospice unit? Okay. So the impact, because there's no level 3, patients with complex needs have to be admitted to the acute hospital for care. Home care teams, which have made great strides, they don't have that dedicated support of a full multidisciplinary team. And I look and I talked to Michael Cushion this week about the shortages in social work, for example, CNS, particularly those people who are specialists to deal with all this. They don't have access to all that full range of services. There are no daycare, there's no outpatient services. And then the acute hospitals don't have the level of support and backup from the specialist care that's required. And I won't go through this slide, but this is the latest data from the CSO, which shows the higher level of patients in acute hospital in the Midlands who die in the Midlands. And that's all deaths in the Midlands, not just those from cancer. Okay, so what the Midlands needs? It needs its level 3 inpatient hospice unit. That's a mouthful, I know that's a mouthful, and it will become called the regional hospice, and that's lovely. But that was promised in 2001. It needs the acute hospital, it needs support for acute hospitals for the staff here, more CNS and social work skills. In the community, there are nursing staff shortages with little coverage at times of holidays. It's not fair if somebody takes their holidays that there's no cover. There's no service after 5 p.m, but the service has extended to 7 days, which is great. The provision of the full range of specialist and generous palliative care needs to be there in each of the Midlands counties. There's no outreach hospice daycare service which could be available one day a week in each county, which is done in other areas. There needs to be support for the Hospice Friendly Hospitals programme, which is operating in all of the hospitals. So earlier this week I took time to go and visit our outgoing Minister for Health, who is very supportive of hospice, and he's very supportive of developments. And we've been having conversations with him for the last, I don't know how many years he's been posted, and his predecessor before that, and we talked to him about the need for a level 3 unit. And I appreciate he is an outgoing Minister for Health, but he is part of the current government. And he reiterated that the model of partnership that happens in hospice across Ireland is the best model in health. And what he actually said was, the model of development of inpatient hospice is that the community or the local hospice group fund the capital development of the local hospice. And what that means is that you're not waiting to try and get on a very long list of capital estates projects from the health services the community are funding. And this is what has happened all over the country. This is what has happened. He said to me, they are fully committed, and he had Department of Health people in the room, and we took minutes of the meeting. They are fully committed to funding the cost of the revenue, which costs a lot more. There's a lot more money in the revenue, and that's a great commitment. And he said it's the best example of partnership working in action. So what I'll be talking to the Lions Club, and what they're going to do now is go back in, presumably to a new Minister for Health, and get that in writing, because that's what the other areas have done. But it's a start. They are committed to having the revenue if the community raise the capital. And I think we have a short window of time. We don't know what's going to happen around the corner. We don't know what's going to happen that they mightn't be able to give that commitment. So I think having that commitment is fantastic. The experience everywhere else, people have said to me that they're worried that, well, if we fund this, our community services will be upset. People won't be able to die at home. That's not what's happening all over the country. And I'm going to give you an example of Kerry. Kerry opened about 2 years ago. Fantastic man called the name of Ted Moynihan, who spent his whole life campaigning for Kerry Hospice, and he'd be delighted to see what's happening tonight. They opened up Kerry Hospice, and getting Kerry Hospice opened, they managed to augment and support the community services, so all the services in the community went up. The service in Kerry Hospice, based in Kenmare, is available for all of the county of Kerry. And Kerry's a big county, all the 4 peninsulas. All of the county and all of the region got in behind Kerry Hospice, and they are now seeing their service massively improved. In Waterford this week, they signed up 50 new posts. 50 new posts. Imagine that, Michael and Pauline, 15 new posts for specialist palliative care in Waterford in advance of the opening of the inpatient unit. That's the prize that's there. That's what could be there. What you also would have is the regional inpatient unit of training and education needs will be addressed in all the care settings. So in all of the other areas of the country, what they have is they have a regional unit specialising in training and end of life, and they provide that training out in nursing homes or back into acute hospital or for different staff. So the whole area is improving. I won't go through this, but I just want you to look at the number. Since I've started, 14 new hospice developments have happened around the country. Some of these hospices are on their 3rd redevelopment. And I think it's just shocking that the Midlands is still there and we haven't even got started and the work hasn't started. But tonight is fantastic. These are some of the photographs of some of the hospices there. Every single one of those hospices have extended their arms out with open invitation. I know some of the Lions and some of the different hospice groups have gone and visited these. These are some of the pictures. Wicklow is about to open the 24th of this month. This one over here is Raheny. This one here is the one in Blanchardstown. This one here is Kerry Hospice. I think one of them's Kerry, and I've forgotten which. One's Mayo Roscommon. They're all opening. They're all fully run. They've all got the commitment from the HSE. So I think a united front is needed. I think the time for reports, for strategies, for vague commit is over. It's time to commit. It's time to act, and it's time to deliver. And you have that here tonight. Look at the energy in the room here tonight. It is just amazing. The only way forward is together. The 4 counties coming together to really put the pressure on, to keep acting. We have a new election coming up, all of that. There's a lot we can do, a lot of commitments we can get, but there's an awful lot we can do to support this campaign. So on the way down tonight, I was late because I was passing by all the farmers on the coming down from the demonstration, and they hate all my colleagues love, they hate them in Dublin, they think it's terrible. I think it's brilliant. The farming community understand the cycle of life and death. They see it, they live it, they know how important it is. They also know how important it is to get up and take the day off and go and make that protest today, because that's what all of those guys did today, is they went up and they made their mark. They are going to get behind this. The farming community here tonight, I think you're going to get behind it. This is a cause worth following, worth supporting. So we've a lot we can do in terms of lobbying the local TDs. There's a lot we can do in putting together a united front regional inpatient unit, and I will look towards the HSE to really follow up and look to Pat to try and make that firm commitment. Getting revenue to fund the hospice is the biggest thing we can do in the next while, and certainly we'd be very happy to work whatever we can do in the Irish Hospice Foundation. We've been able to pledge 25,000 to start this campaign. I think it's fantastic. I'm really excited. The very best of luck, guys. Thank you very much.